So, hello students, this is SriRam Shastri, and today I am continuing with the topic of the osteology. So, in osteology, the continuation of the topic from where we had left is the skull of the rabbit, that is osteology of rabbit. So, this is the lateral view of the upper part of the skull, right? So, there are the different parts which I have labeled here in the diagram. Go through it. It starts with incisors, premolars, nasal processes, frontal, optic foramen, orbitosphenoid, lacrimal process, then frontal, supraorbital, sphenoid fissure, then pterygoid, alisphenoid, zygomatic process, then parietal, squamosal, posttympanic, interparietal, supraoccipital, periodic, external auditory meatus, stylomastoid foramen, occipital condyle, paraoccipital, tympanic bullae, basioccipital, basisphenoid, pterygoid, palatine, jugal. These are the teeth, that is molars, premolars, zygomatic process, maxilla. Right. So, in short, we have to discuss about this diagrammatic representation also. The skull can be divided into occipital ring, parietal ring, frontal ring, and ethmoid rings. Okay. So first of all, if you talk about occipital ring is this part, the what you call as hind part of the brain, contains foramen magnum. Okay, then contains 4 cartilaginous bones called supraoccipital above the foramen and exoccipital. Then at the lateral side, basioccipital on the floor. They are having these bones. Then if you talk about the parietal ring, okay, parietal ring is this part. Parietal ring consists of includes ventral basisphenoid, lateral alisphenoid, and dorsal parietals and interparietal bones. Right. Coming to the next part, there is squamosal bone. Squamosal bone generally is rectangular and lying ventral to the either sides of parietal bones. It continues with a narrow process called post-tympanic process. The outer surface of squamel gives zygomatic process, which contributes to the posterior part of zygomatic arch. Under this surface has glenoid and mandibular fossa. Then if you talk about the other parts of the parietal region, it consists of ventral processes and interparietal structures or interparietal bones. Right. In the interparietal bones, if you continue, they are having basisphenoid and alisphenoid processes. There is a small depression called sella turcica where pituitary is situated. Then there is a structure in the posterior part, a deep notch is present called as foramen ovale that will be transmit to the 5th nerve of the cranium. Then if you talk about the frontal ring, this part, the frontal ring, it consists of presphenoid, orbitosphenoid and frontals. Presphenoids and orbitosphenoids form the floor of cranium. Generally, the orbitosphenoids and presphenoids are present in the frontal part of the brain. The interorbital septum is present, which is vertical median, and generally has conjoined optic foramens. Then frontals, if you talk about supraorbital processes are forming the crescent structures in the frontal region. Then if you talk about the ethmoid ring, it is consisting of a single structure called mesentemoid. Okay, mesentemoid. Mesentemoids are formed by the nasal septums and cribriform plate. Then if you talk about the sense regions of the skull part, it includes the olfactory capsules, auditory capsules and orbits of eye. Then generally if you talk about the olfactory capsule, it includes nasals, vomer and tribunals. Auditory capsules include periotic, tympanic, in that separate bones which are prootic, epiotic and opisthotic regions. Coming to the next part of the what you call as cranium, that is the region in the tympanic region. If you talk about in the tympanic region, they are consisting of flask-shaped structure called tympanic bullae. It consists enclosing three ear ossicles, that is malleus, incus, and stapes. This tubular structure is connected to external auditory meatus, and it opens in stylomastoid foramen, which is the exit of the facial nerve from the skull. Right. So this is about the discussion of the upper part of the skull. The lower jaw or the mandible we will discuss in the next part of this session. Thank you.